Hello everyone, welcome to today's session where I will guide you through essential dietary recommendations to support your miracle drinks treatment protocol. Dietary guidelines and recommendations. Number 1, salt intake is use 1 gram of salt per meal, and to manage this precisely, use a pocket size salt container. Second, prebiotics for gut health. Every morning, once on an empty stomach, consume 2 to 3 small pieces of garlic, that is Indian size, 1 inch sliced ginger, 1 teaspoon of soaked or sprouted fenugreek seeds, that is the methi. These act as prebiotics, that is a food for the beneficial microbes in the gut, supporting gut health and overall immunity. Third, banana stem juice. Consume 50 to 60 ml twice a day if it is available in the morning and once in the evening. It helps remove calcium deposits from arteries and capillaries. Note, monitor your potassium levels while consuming this. Fourth one, leached raw vegetable juice. Drink 50 to 60 ml twice a day in the morning and evening. This juice aids in maintaining cholesterol levels, thinning blood, and addressing gastric issues. Important, carefully follow the leaching process to ensure optimal benefits and safety. Fifth, leached vegetable salad. Consume in limited quantities, ensuring potassium levels are within a safe range. Follow the proper leaching process. Fruits. Enjoy any fruits or berries in limited quantities, keeping potassium level in check. Avoid bananas due to their high potassium content. Seventh one is flax drinks. Drink twice daily in the morning and evening without adding water, those who are on ascites. Benefits include omega 3 and omega 6 essential fatty acids to support cellular metabolism, high lignans content to detoxify cells. Fun fact, 1 glass of flax diet equals the nutrient value of 100 kg of peanuts. Eighth one is cooked leafy vegetables and vegetables preparations. Ensure that more than 60% of your meal consists of cooked leached leafy vegetables and vegetable preparations with 5 to 10% of pulses and spices. Leafy vegetables are rich in calcium, fiber, and easily digestible proteins, making them excellent for any patients. Preparation tip, boil vegetables, drain the water, blend with spices, and prepare a delicious curry or sabji. Pulses. Use pulses sparingly, no more than 5 to 10% of your meal. Opt for green gram, chickpeas, beans, cowpea, which are rich in easily digestible proteins. 10th one, cereals. Limit cereals like rice, wheat, and jawar preparation to 25 to 30% of your meal. Avoid coarse grains like ragi and minor millets as they are high in potassium. Excessive cereals consumption can increase creatinine, urea, uric acid, and sugar level. Fish. Baked fish with herbs can make up 15 to 20% of your meal. Fish supports kidney and organ regeneration. Chicken. De-skinned baked chicken is allowed but should not exceed 5% of your meal. Mushrooms. Like fish, baked mushrooms with herbs can be consumed in quantities of 15 to 20% of your meal. Mushrooms are also supportive of organ regeneration. Spice drink. Include a spice drink in your routine to help with allergies, fever, colds, and coughs. Important preparation notes. When preparing vegetables and leafy vegetables, avoid adding salt initially. After cooking, portion out the required amount for the patient, and family members can add salt separately. For more detailed preparations methods, refer to the specific chapters in the relevant guide. Final thoughts. Your diet is the foundation of your health. By following these guidelines and making thoughtful choices, you can significantly improve your well being and support your recovery journey. If you found this information helpful, please like, share, subscribe to our channel for more health tips and dietary advice.